Sure.
Alright. I close the curtain. Do hand hygiene. So can you give me your full name and date of birth?
McKenna Myers, April 7th, 2000.
Cool. And where are you at today?
Home College.
Alright, cool. And what's the date?
April 9th, 2019.
Cool. So you're speaking to me, which means you can communicate, which is really good. So first, if you don't mind, I'm going to check your pupils for Perla, which is pupils are equal, round, and reactive to light and accommodation.
Sure.
So could you take off your glasses for me? Alright, look at my nose. And then look at the wall, and back to my nose. Okay, good. That was for accommodation. Cool. Now, for the Glasgow Coma Scale, when I walked in, you looked at me and you spoke to me. And you took off your glasses, which means you have motor function.
Mm-hmm.
So I would give you 15 out of 15 for the Glasgow Coma Scale, which is good. So now I'm going to test your muscle strength.
Sure.
So I'm going to put on hand sanitizer, waiting for it to dry, and then push against my hand, then again, to the side, and to the other side. Good. And keep your arms like this. Okay, push up, push down. And can you flex them for me? Okay, resist my hands. Good. And I'm going to do your legs. Okay, and resist my hands.
You're okay.
I know, and resist. Good, and your feet. Perfect. So I'm going to do your respiratory assessment, so that's alright. So have you had a cough recently?
No, I have not.
No? Alright. And I'm looking at your respiratory rhythm. It's very relaxed, it's not labored, which is really good. And your respiratory rate, I'm going to count that if you don't mind.
Sure.
Here. About 16, which is really good. I'm going to auscultate your lung sounds now if you don't mind.
Sure.
Okay. Do you mind if I stick my stethoscope in?
Sure.
Or let's breathe through your mouth. Alright, excuse my hand. Okay. Oh, sorry. This side. And now I'm going to listen on your back, so do you mind leaning forward? Thank you. Alright. Your breath sounds are clear and regular, which is good. Alright, I'm going to start your cardiovascular assessment, but first I'm going to do hand hygiene. So I'm going to touch your skin if you don't mind.
Sure.
So your skin is nice and warm. Sorry, I don't mean to like push you up and down, but your skin is warm. It's appropriate color for your ethnicity. It's not clammy. I'm going to test your skin trigger, if you don't mind. Alright. And I can't test your cap refill on your fingernails because you have the fake nails on. However, I would check with the toes. Check your toe refill. Thank you.
There's a flap.
Okay. Yep. And it's under 2 seconds, which is good.
My feet are blue. Anyways.
And I'm going to listen to your apical pulse, which is right here. Can you lay down? I'm going to check your apical pulse. Okay. Do you mind if I lift up your shirt? Sorry. Can't hear it over wire. Okay, and it's a normal rhythm between 60 and 100. And I hear the S1 and S2 sounds, which is good. Do you want to sit back up? Sure. Okay, and now I'm going to check your pulses. So can I see your radial pulse? And this pulse. Good. And I wouldn't do the femoral pulse because it's in a private area and this is in a real setting, so there's no need to. So I'm going to look at the proximal tibial, sorry. And the pedal pulse. Good. And I'm going to check for edema. So can I just take
Don't
that
check
off?
my legs.
Just
Sorry.
edema?
Yeah. Wait, that's smelling right.
Yeah.
Yeah.
Okay. So I'm checking the arms. You have no edema in your arms.
Thumbs down. You can see. Sorry, I'm just gonna do this for you.
Ooh. Okay.
I know. The Capri fill on my legs isn't good either.
So could have, I would say, +1 hitting edema. That leg, not that one.
Right leg.
Right. So now I'm going to do the urinary assessment. So, would you say your urine's adequate?
Yeah, it's like a pale yellow, usually sometimes
Good.
clear.
Good. Do you feel like it's the proper amount?
Yeah, for like what I drank through the day
Okay.
and all that, yeah.
Good, good. So I'm going to do the gastrointestinal assessment. So can you open your mouth for me? Okay, it's pink and intact, and your tongue is pink, and it's within normal limits. I'm going to start my abdominal assessment. So would you mind laying down for me? Perfect, thank you. I'm performing hand hygiene. Okay. And do you mind if I lift up your shirt a little bit just to see your abdomen? Okay. Oh, it does not need it there. Perfect, thanks. So when was your last bowel movement?
Last night.
Okay, and how often do you usually have bowel movements? Like once, twice a day?
Probably once.
Okay, and are you continent?
Yes.
Okay, cool. Do you have any nausea, vomiting?
No.
No? Do you have any pain on your stomach?
No.
Okay, so I'm gonna form this up while I do your inspection. You're symmetric, which is good. You don't have any lesions or protruding masses, so it's good. I'm gonna go ahead with my auscultation. I think I'm putting it on right. Okay, so I'm listening to the first episode. Lower quadrant. I'm gonna put like music over that, like doo 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 doo.
Isn't it like higher?
No, see, this is the lower, this is the upper.
Oh.
Okay, you have equal bowel sounds every 5 to 15 seconds. I'm gonna palpate with my fingers. Just feeling for any lumps, bumps, or masses. All right. Do you want to go ahead and set for me?
If I was to have any lumps, bumps, or masses, I would take a ruler and I would measure the length.
How would you say your nutrition intake is? Would you say that's adequate?
Yeah.
Okay, cool. So now I'm going to do your skin integrity. So now I'm going to do your skin integrity. So your skin is intact. It's the right color for your ethnicity. You don't have any discoloration, no bruising or cuts or anything.
Yep.
So do you have any pain?
No.
No?
So this is when I do the neurovascular assessment.
the cast.
McKenna obviously doesn't have a cast, so we improvised by using a pillow
Oh yeah.
case.
Okay, and now I'm just going to check your cast. Checking for any hot spots. Okay, and your extremities. They're warm, which is good. You can close your eyes and I'm going to touch your finger and I want you to tell me when it is.
Thumb.
Yep.
Whatever this ring finger.
Great. Good job. And last one.
Middle.
You don't have any drainage from your cast. Your color is normal, your temperature is normal. You don't have any hot spots. And can you push against my hand? And like that. Good. And you can move your arm.
I mean, as much as you can with the cast.
Thank you for your time.
No.
Okay, McKenna, I'm done with your head to toe assessment.
Okay.
Thank you for being patient with me. Just gonna put the bed rail down to protect patient safety.
I do hand hygiene and then leave